Recently, the Society for Vascular Surgery has decided to establish an audio-video archive of individuals being interviewed for their contributions to vascular surgery. Under the chairmanship of Dr. Jimmy Yao of Northwestern University in Chicago, Illinois, we are securing the interviews of those who have contributed to vascular surgery and become famous for their interviews. I'm Norman M. Rich, and I will be conducting today the interview of the legendary Dr. F. William Blaisdell of San Francisco, who is a renowned contributor to vascular surgery. Dr. Blaisdell, welcome and thank you for your willingness to be interviewed for this historic moment by the Society for Vascular Surgery. And if we may start with your early years in Watsonville, California, we would appreciate that since it's not too far from the Stanford campus where we're now having this interview. Please, if you would.
Yeah, Watsonville is about 100 miles south of San Francisco. My father went into practice there with his brother. My father was an internist. His brother, my uncle, was a surgeon. And they started practice there in the late 1920s. I was born in 1927 and raised in Watsonville.
Did you always know you were going to be a physician as well because of that background?
I think from the standpoint I knew what a doctor was. I wanted to be a doctor, yes.
Yeah.
All my both grandfathers were doctors, and every male relative in my family was a doctor.
Well, you know, one little sidelight, because we're always told that Watsonville is the artichoke capital of the world. Did you ever work in the fields as a young lad, or did
Well, you got it wrong. Castroville is the artichoke center. That's about 10 miles away.
Yeah.
We were apples, primarily in that area, yes.
Yeah. No, I was just wondering if working in those fields instilled in you an interest to pursue medicine even more, rather than ending up working in the fields.
Well, I picked tomatoes. That was my primary work in the field when I was in high school. There were labor shortages, and to get the crops in, high school students were recruited. So I spent a number of summers working with tomatoes.
As a Stanford undergraduate, was there some reason that you chose to go to Stanford?
Well, I had two generations of my family were there. My mother and my father were both graduates of Stanford, and my grandfather was a professor there, so that was a pretty good reason.
Yes, and that also stimulated you to go to Stanford Medical School, probably.
Yes, it did.
Yeah, good. In your family, there was a surgeon, correct?
My uncle, yes.
Yes. And your grandfather had been at Stanford in the very early years in San Francisco as well.
He was a professor of surgery, but he was primarily an anatomist. Anatomy was in the surgery department in his era.
Do you remember anything about your early years at Stanford in medical school? Did you find it challenging, or did it reassure you that you'd made the right choice? Or
Well, always when you start medical school, there's an insecurity because of the high quality of people around you. And I think it wasn't until the first examinations came out that I began to feel a little bit secure that I would probably make it through medical school.
being on the West Coast and with all this background, why did you elect to do your internship in Philadelphia?
Well, I thought it was about time I got away from the mother institution, and I wanted a rotating internship. I was threatened with the fact that if I wanted to go into surgery, that was no way to go. But I was a little obstinate and decided to go to what was then the second largest hospital in the country.
There was something in the world going on about this time called the Korean conflict. Did that have any effect on your life at this period?
Yes, because doctors were being drafted, and all of us in our internship knew we were vulnerable to the draft. So before we finished my internship, I volunteered for the Navy so I could go and leave in July and come back in July and not miss out on a residency.
You've kindly shared this with me in the past, but would you mind telling us a little bit about the exciting experience you had in the ship-to-ship transfer on the high seas?
Well, when the doctor came aboard and my ships were in the Mediterranean, I was a division medical officer, and the we had to join the Sixth Fleet, but before we joined the Sixth Fleet, we had to catch up with them. And two of the ships were together. Two of my destroyers were together, and the first night I think we were at sea, they said, "Emergency, emergency, doctor, the next ship." And they shot a Highland across, and I didn't ask any questions. There was an underwater telephone, but I didn't know anything about that. I could have communicated with the other ship, but they shot the line across. All the sailors came to the on deck to watch the doctor being transferred. And just before I got into the breeches buoy, they handed me a package. "Would you take this over, Doc?" I took it over, and it turned out I was part of the movie exchange. When I got the other side, they handed me a corresponding package and then highlined me back. Meanwhile, they took turns kind of dropping me in the water. The Mediterranean was quite calm at that time, so that was my initiation.
So many people do zip line activities today as a recreation, but you had that opportunity provided for you by the Navy, so that's really fantastic.
Yes,
When you finished your commitment, you did stay in the reserve for a few years. Is that well?
Yeah,
Is that
10
right?
years.
Yeah, 10 years as well. You did then come back to Stanford
Yes.
for your surgical training. Would you please tell us a little bit about your surgical training back at Stanford?
Well, Stanford was essentially a clinical school, and it was still in San Francisco, but the decision had been made at that time, which was about 1952, to move the medical school to the Stanford campus. And so during most of my training at Stanford, my 5 years of residency, building was going on down on the Stanford campus. So I was the last chief resident in surgery to complete my training in San Francisco. My training consisted of about half time at Stanford Hospital and half time at City and County Hospital.
Your career has been focused on helping the patients who have had the misfortune to be injured. Vascular surgery has been a part of that. Is there anyone during that era of your training that really helped you as a mentor?
Well, I would say the one I most closely identified with was Roy Cohn, who had a reputation of being an outstanding military surgeon during World War II. And for various reasons, I became quite close to Roy.
Dr. Holman, who had been William Stewart Halstad's last chief resident, was the chief of surgery, the first full-time chief of surgery at Stanford when you were there, correct?
That's right.
Did you ever have any interaction with him about vascular surgery?
Not really, no. Vascular surgery wasn't an independent concept at that time. Thoracic surgery was not even a specialty. So surgery consisted of whatever there was in general surgery, which included plastic. Orthopedics was separate, neurosurgery was just beginning to separate, although it was still part of general surgery training when I went through.
Well, Dr. Holman also had a laboratory that he named from his Johns Hopkins experience. Did you have any experience in his laboratory at all?
I had experience in that laboratory when I was 5 years old because it was my grandfather's laboratory. So, yes, I can remember riding up the rickety old elevator when I was 5 years old, scared to death on my way up. And when I was in medical school, a couple of the deaners that my grandfather had hired were still there. So, yes, I was very familiar with the laboratory.
A lot of history there.
Yes.
Why did you go to Boston, if I may ask, in the midst of your training at Stanford, your surgical training?
Well, that was a year of a pyramid training program. 6 of us started, and only one of us was due to finish at the top. In my second year, the professor of surgery called me in and said, "Bill, how would you like to go to Boston?" Now, the significance of that was that it was probably in line to be the chief resident because they usually sent their prospective chief resident to Johns Hopkins or to Boston. And so when I was asked if I wanted to work with Franny Moore, the answer was yes, because that gave me a high probability of finishing at the apex of the residency.
Oh, well, that was a great opportunity. And then you did come back to Stanford.
Yes.
And can you tell us about finishing up at Stanford?
Well, I finished up My next to last year or senior residency was entirely at the City and County Hospital, at that point called San Francisco General. The name had changed somewhere in there. And then my senior year was 6 months at General and 6 months at Stanford.
You know, you don't remember, we've talked about this before, but I remember very clearly when I was sent to the operating room about 3 o'clock in the morning and you were taking care of a patient who had had a low velocity gunshot wound of the infrarenal abdominal aorta. And that's something that stays in my thought process and something that continued to stimulate my interest in following a career in vascular trauma. So I thank you on this historic note. And let's move on to going to Houston and to being with Dr. DeBakey, if you would, please.
Well, during my tenure in Boston, I had the opportunity to work with Richard Warren, who started one of the first vascular services at the VA Hospital, West Roxbury. And no one wanted to work in vascular surgery with Dr. Warren. He had a separate service because the residents didn't get to operate. But this was a fascinating field for me, so I volunteered, and so my entire 4 months at the VA hospital was with Dr. Warren. And when I was finishing, I said, Dr. Warren, I think I'd like to go into vascular surgery. What do you advise? And he said, Bill, there's only one place to go. And I said, where's that? He said, Houston, Texas. And I'll help you if you want to go there. So when I came back to Stanford to finish off my last 2 years, I had fixated on going to Houston. And with the help of my professors and Dr. Warren, I obtained a fellowship.
And how long were you in Houston?
1 year, although it seemed like 6.
And one of your famous contributions that everyone focuses on, the axillary femoral bypass, was from that experience in Houston. Would you elaborate on that for us?
Well, in that era, DeBakey was doing something like 8 major vascular operations a day. Kind of unheard of. Maybe 6 abdominal aneurysms and a couple bypasses thrown in. And his complications were negligible, but he did have complications, and no one really ever dared to show him a complication. So the rare patient who had a major complication was discharged and then readmitted to a rehab hospital across the street, where the fellows took care of the patients under one of the junior faculty's name. And there was a couple of vascular infections, and I did everything I could to bathe them in iodine and do various things to try to get these exposed groin vascular grafts, because that's where the problem was, healed. And none of them healed, and the story was everyone was going to rupture eventually. And so I knew that once you got an infection in a vascular graft, you had to do something else. And that was kind of the key to my subsequent interest in profound bypass.
Obviously, Dr. DeBakey was very appreciative. You later became president of his international society and you received the DeBakey Award. We'll come back to that a little bit later. But when you finished in Houston, you did return to San Francisco, and initially you were at the Veterans Administration Hospital.
That's
Please
correct.
tell us about that.
Well, I was supposed to go back to Stanford when I was in my residency training. All my old professors said they'd welcome me back, but they had changed chairman while I was in Houston, and the new chairman had no interest in me whatsoever. So I interviewed with Dr. Dunphy in Portland, Oregon, because my colleagues suggested that Dr. Dunphy had just gone to Oregon, might be hiring faculty. So I interviewed with Dr. Dunphy in Oregon. Then one of my professors, Carl Mathewson by name, said, Bill, come back and interview for the chief of surgery at San Francisco VA Hospital. I said, well, I'm not sure I'm qualified. He said, well, you come back and interview. I'll talk to Dr. Leon Goldman, who's chair of surgery, about you. And he said, I've told him that Dr. Dunphy offered you the job as chief of surgery at the VA hospital in Portland. I said, that wasn't true. He says, well, whatever you do, don't say otherwise. So I sat down with Dr. Goldman for an interview, and he said, so you've been offered the job by Dr. Dunphy up in Oregon. I just smiled, didn't say anything. And so I left the interview not suspecting that I was going to be offered the job, but about a week later, I called and I had the job offer just in the nick of time because it was getting close to July 1st when I was finishing in Houston. And I had 5 little children by then. So not having a job prospect was disconcerting, to say the least.
Well, you made some very important contributions in your time in the VA as well, and I know you had some good colleagues and allies. Al Hall is one that comes to mind. Would you say a few things about your relationship with Dr. Hall?
Well, Dr. Hall had just completing his training at the VA hospital and was asked to stay on in the interval between my arrival and when John Wilson, my predecessor, had left the VA. So Al was there when I came on board, and I subsequently hired him as my additional faculty member.
Not too many years after that, you moved on for one of your very, very important times in your life at what we had known as the San Francisco City and County Hospital. It had become San Francisco General, and you were there from 1966 to 1978. Would you talk a little bit about that era?
Well, let me finish the VA first. I think most of my major contributions were in the 6 years I was at the VA. I had a laboratory, which is part of my negotiation, and I started a cardiac surgery program, which was actually the first in the VA. And I was given a laboratory, a dog facility, and that was the key to my academic productivity. And I probably did more unique things there at the VA than I ever did again. When I went to San Francisco General, Medicaid and Medi-Cal had just come on board, and my predecessor, Bill Silen, had said, well, good luck, Bill. They're going to close all the county hospitals. They aren't necessary any longer. So I took over at San Francisco General just about the time when all the Vietnam War activism was going on. And at the same time, psychiatry discovered they could treat hospitalized patients with drugs and turned all these psychiatric patients loose on the streets on drugs. And that was really the start of the drug culture. The protests of the young people took up the drug culture. We had the psychiatric patients on the streets with the drug culture. And all of a sudden, the city of San Francisco became a violent place. In the course of 1 year, crimes of violence doubled. My first year of arrival. A year after that, they doubled again. They threatened to double again after that. And the city became a violent place almost overnight, over the course of a couple of years. And that was when we first organized a trauma program.
Well, thank you for the clarification. And this is one of the reasons that these interviews are valuable, because most people would not know your own personal feelings about your academic accomplishments while you were at the Veterans Administration Hospital, and that's very important. Most of us remember those who worked with you and who you trained when you were at San Francisco General, and the list is quite extensive, starting with Don Trunke and George Sheldon and Bob Lim and Frank Lewis and Muriel Steele and
Brent Eastman.
So many people really benefited from your leadership at that time of your life, and that's why you were recognized as the original Mr. Trauma of the world, I think, and your proteges really continued in that same venue for you. Would you comment on any of the people you trained?
Well, I was very fortunate because my professor at that time was Dr. Dunphy. He was at Portland when I interviewed there, but 4 years later, I was the only surgeon on the search committee for the new chair at UCSF. And obviously I put Dr. Dunphy's name in, and the rest of the committee said, well, why would he ever come here? And I said, well, I don't know, but I think we ought to ask him. And we did, and he was interested. And so he moved in 1964, while I was still at the VA, he came as chairman of surgery. And Dr. Dunphy was a world traveler, and every time he'd leave and go someplace, we'd have a whole flock of resident applicants. And so all of a sudden, overnight, we had a lot of outstanding people in our UCSF surgical residency. And those many of those stayed on to work with me.
You did something else that was quite unique and recognized by many of us with your trauma fellowship type program. Fairly early on, you also established a return for some of the people that went into private practice, like Norm Christensen or Joe Ignatius, who would come back every 4 years or so and spend another month or two with you for kind of a fine-tuning of the trauma experience. Would you elaborate on that a little bit, please?
Well, actually, one of the things we thought appropriate for our chief residents was to have contact with some outstanding clinical surgeon. And so the last week of every one of my 6 chief residents' tenure at San Francisco General, we invited one of our alumni at Stanford or UCSF to come back and spend a week living in the resident quarters with the chief resident. And he had access then to somebody in private practice, and they had clinical expertise which they could provide, which was unique.
Many people benefited from that and really appreciated that experience. Out of all this, Dr. Blaisdell, you were recruited to be the professor and chairman of surgery at the University of California, Davis. Would you please tell us about your accepting that and what changes that made in your life?
Well, first, when I was first asked to interview at UC Davis, I wasn't really interested because it had the reputation of being a family practice school. It was the first medical school established after World War II, and it was established on the basis we were going to train family doctors. But one of my former trainees up in Sacramento urged me to come up and look at it. And I did, and I found out that the family practice school was kind of a sham. The dean was politically motivated, and he managed to build specialty departments on the basis that it was necessary for training of medical students who were going into primary care. And when I interviewed with the primary care chief, he said, this is a sham. You know how many full-time positions I have? And I said something, I don't know, dozen? He said, no, I've got four. He says, ENT has four. And I has four. And that was true. That it was a sham, and but the only problem was that the surgery department hadn't really been developed yet. And it was still had high turnover and had no reputation. So it was kind of a chance to come into a brand new department and try to do something.
There has to be a certain amount of personal satisfaction out of what you accomplished at UC Davis. Would you elaborate on that a little bit for us, please?
Well, I enjoyed building programs.
Yeah.
When I went to the VA, I was the only full-time person in surgery or any of the specialties there. And by the time I finished, we had a vascular fellowship. We had 3 or 4 full-time faculty. Went to general. I was the only full-time person there. And that was just a change in the county hospitals with the advent of Medicaid and Medicare. We had to have supervision and document residents, so I had a chance to build a program there. And I found myself getting bored after a new chair was recruited, Paul Ebert, after Dunphy retired. And I figured, well, Paul isn't going to give me anything. I've got the best part of the department. And so where am I going to go from here? About that time, I had looked at job offers a number of places in the country. But from the standpoint of my family and my wife and so forth, Davis proved to be an ideal fit.
When you were the chairman there, you didn't live in Sacramento, did you? Where did you live?
I did live
But it was on the river. It was on...
Yes, it was in Sacramento, but right, let's say, in the edge of the city, right on the American River.
Yeah,
Yes.
So a beautiful living situation.
Yeah, we'd bought a house in San Francisco for $80,000. Now it's probably worth $3 or $4 million. When I went to Davis, my house had escalated in worth from something like $80,000 to $250,000. So we had $250,000 when we sold it, which gave us a chance to buy one of the nicest houses in Sacramento. So that was a bonanza from the standpoint of the way real estate went during that era.
The contributions you made to the University of California, Davis are recognized in the Blaisdell Library that exists there now. Can you tell us a little bit about that, please?
Well, When I was about to retire, the UC Davis was going to move their entire medical school to Sacramento campus. The first 2 years up to that time had been the preclinical years on the Davis campus itself. And the university had reached a point of maturity which it was appropriate to move the entire 4 years to the Sacramento campus. And so they asked me to help fundraise. And that's about the time I had retired. And I said, well, I'm moving back to San Francisco because my wife has never mentally left there. And said, well, we'd like to call you back and have you help us raise funds for the medical school. And I said, well, okay. And they said, we'd like to name a building after you. And so I said, well, I can't turn that down. So after I had retired, I went back a couple days a week to help fundraise for the new buildings for the medical school.
Well, you were kind enough to take me one day a few years ago back to see the library, and it was very exciting. There's another aspect of this, too, that I think is so important. You've mentioned not wanting to be bored. You've mentioned liking to start new programs, and yet you've always had an interest in history. And part of that was due to your great-grandfather's experience in the war between the states and what led to a special room in the Blaisdell building library, which is the American Civil War section of that. Could you tell us a little bit about that and your great-grandfather?
Well, when I was a small child, my grandfather held me on his knee and brought out this little book and said, Bill, you wouldn't be here if it weren't for this book. What is it, grandfather? He said, this was the book that saved my father's life. And I said, oh, really? He said, see, there's a bullet hole through it. It was his diary. And at any rate, nobody had done anything with the diary. When my father died, I inherited the family archives, which included the regimental history by Bartlett, which was an outstanding regimental history. In fact, it is claimed as such. And I also had my great-grandfather's diary with a bullet hole in it. And the bullet hole went through the writings up until June 1st, 1864, the Battle of Cold Harbor. And after that, there was writing around the bullet hole. My grandfather was wounded in the battle and ended up in Campbell Hospital in Washington, D.C. And so I became fascinated about how he was handled, what care was like. And so I became deeply involved in medical care during the Civil War and started to collect volumes. And ultimately, my collection went to UC Davis Library.
We've benefited from a lecture that you gave us on the vascular trauma in the war between the states, and that can be part of our archive now too. But let's go on for a moment. When you retired as the chairman, you were still anxious to do other things and to start new programs. Would you tell us a little bit about what you got into with the former Mather Air Force Base Hospital in Sacramento and how that developed for the VA?
Oh, well, when I started at my chairmanship at Davis, I knew that I was going to retire at 65 because that was the obligatory retirement age at that time for professors. But there was a governor that came through named Reagan, and he changed all that. So no longer was retirement obligatory at 65 in the UC system. But I kind of conceptually thought that that was an appropriate age to retire. So that was my target. And just after I retired, I stayed on as professor. And that first year after I nominally retired, I went back to clinical practice. They wanted to start a new VA hospital in Sacramento. And so I got called in to ask if I would help out. And that seemed intriguing. So the answer was yes, I'll help develop a new VA hospital. It seems that at Mather Air Force Base had just closed down, as many of the military facilities were doing. There was a 100-bed hospital there, and the VA made the decision to take it over. And so I participated in the development of VA programs at the Mather Hospital. But we no sooner got there than the plan became, well, now let's do something better with this. And so then we lobbied and saying, we got this old facility, now we got to do something. And so we lobbied in Washington and got a new hospital built. And so when that was completed, that was my second retirement.
Well, the thing that's very interesting about that, too, is that when we approach the new facility, we go down Blaisdell Avenue. So there's another recognition for what you've done, and I think that's most appropriate. Let's leave this, since we've had a chance to review your career briefly. Let's go on to the Society for Vascular Surgery for a few minutes. And you were the president in 1978, 1979, as I remember. Do you have any recollections about what happened at that era, what you were proud of in contributing to the society?
Well, that's when we were starting vascular training. I go back a little bit. I met Jim DeWeese 3 or 4 years before that. During the Johnson administration, he was promoting cancer centers and heart centers and so forth. And Jim had been asked to chair development of vascular surgery, recommendations for vascular surgery facilities. And Jim, out of the blue, called me one day and wanted to know if I would be on his committee. And so what the question was, well, what is appropriate for a vascular surgery facility? And Jim and I and our committee concluded it was the quality of the vascular surgeon that influenced the vascular center more than any other, more important than the clamps or this or that, the quality of the vascular surgeon. And there were no standards for vascular surgery training at that time. Anybody could declare himself a vascular surgeon. So during my tenure, we established the original committee, developed vascular training requirements. And the start of that was during my tenure as president.
Well, and you've contributed with your colleagues like Dr. DeWeese on the optimal utilization of resources in vascular surgery, and certainly we're very grateful to you for all of that. At the time that you were the president, there were 2 societies. There was the name changed several times, but I think at that time it was the International Cardiovascular Society. Do you have any recollections about how those 2 societies worked together, or what the challenges were at that time?
Well, the Society for Vascular Surgery was kind of the academic component. And I would say the restrictions for membership included innovation as demonstrated by quality of papers. The International Cardiovascular Society was more of a general, all-inclusive society for clinical vascular surgeons as well as academic vascular surgeons. And the 2 ultimately melded, as you know.
2003, it all became the Society for Vascular Surgery. Do you think that's been a good decision, and do you think today vascular surgeons have a stronger position because of that?
Yes, I'm sure they do.
Internationally, since you've traveled internationally as well, what do you think the United States position is in vascular surgery compared to other countries around the world?
Well, I think we've been ahead of most everybody else, and thanks to some fundamental developments. But for example, the Dacron graft that the Baking developed established the principle of bypass grafting, and also for the first time offered a satisfactory substitute for major blood vessels. So that was a major contribution that put us way ahead of anybody else. The Japanese have done a number of innovative things over the years, particularly with microvascular surgery. And another component that was important to the development of vascular surgery was the microvascular concepts, which subsequently led to more peripheral bypasses and techniques that permitted you to revascularize the lower limb.
I know in your training and your subsequent career, you did many of your own arteriograms, including catheter-based arteriograms. What do you think about the revolution into endovascular surgery today?
Well, that was the national outgrowth. But, to start of vascular surgery, all vascular surgeons did their own angiograms. And when I was in Houston, they were mass-produced, more or less. So when I went to the VA in San Francisco, we fortunately had a radiographic unit in one of the operating rooms, and we converted that into the vascular angiogram suite. And I can remember that chairman of neurology at UCSF challenged me about doing cerebrovascular angiograms because they said you're going to kill people. We were at that time involved in a national study of cerebrovascular disease, and that required studying all the major vessels, the vertebrals as well as the carotids, in one exam. Now, it was fortunate about 1960 that the organic dyes had come in and were much safer than the previous materials such as potassium iodide. And nobody had really documented that yet. And so we got involved and we reported our first 300 cases of panarteriography in defense against this neurosurgeon's attack on me, and reported negligible complications from the angiograms.
Follow-up angiography, particularly after carotid endarterectomy, that was an area that was of interest to you in your career. Would you comment on that for us, please?
Yeah. Well, this was the early era of carotid surgery, and we were involved in Houston when they were just putting it on the map. And I fortunately got my name on a paper, one of their original papers. So nobody really knew too much about techniques and the subsequent follow-up. And so what I started to do was to start to angiogram my patient's completion of operation. And I found a number of defects in the operations that I had done, and I went on to correct those. And as a result, I had a negligible complication rate from cerebrovascular surgery. And I subsequently laid down the challenge to the society. If you don't think operative angiography is of any value, do 10 and see what you got. And I presented this paper, and I was shot down in flames. But then, I forget who it was, one of the surgeons followed up, it might have been Jim DeWeese, and the next year presented his own paper saying Bill was right. You know, there are defects in our technique, and I think this is the appropriate thing to do. So all my life, I completed my carotid angiograms with arteriograms, and I ascribe that to success in preventing subsequent thrombosis and complication.
Well, as in so many other areas, we learned from you, and we certainly benefited from that too. Let's talk about a very unusual experience near the end of your career when a famous basketball player on the Sacramento Kings was involved in an automobile accident, and all of your experience and your knowledge saved his life. And the reason I bring it up and ask you to comment on that, do you think if you hadn't been there that he would have survived, or that there are many people at that time in the United States who could have had a survival with that horrendous type of injury?
Well, I think he might have survived. I think he would have lost one lung, pretty much for sure. But that was an interesting story. That was Bobby Hurley, right, who was at Duke and #1 draft choice of Sacramento Kings. And I was flying back from Chicago, matter of fact, Jimmy Yow's program. And as we were coming in to the Sacramento airport, my wife looked out of the window and she says, "There's a lot of ambulances down there." The stadium for the Kings was a short distance from the airport. I said, "Oh, that's interesting." I sooner got home and I got a phone call from Bob Albo of the Warriors down in San Francisco, and he said something has happened to Bobby Hurley. And I said, "Oh, really?" "Yeah, can you tell me about it, Bill?" And I said, "I don't know. I just got back from Chicago. I'll call in." Called into the emergency room, and they were resuscitating Bobby Hurley. And they had just put an endotracheal tube in, and he'd blown up like a Michelin balloon. But my chief resident had just done a chapter with me on bronchial injury. He says, "Dr. Blaisdell, Bobby Hurley's got a ruptured bronchus, and we're taking the operating room. Can you come?" And so we went in and sewed his bronchus. But he had a complete separation of his left mainstem bronchus. But as soon as they got a tube in his right main bronchus, they could resuscitate him. So I think he would have survived, but the probability is he would have lost his lung. And the interesting thing was that after the operation, his mother said, "Would he live? Will he live?" And I said, "Yes, I'm sure he will." And his father said, "Will he play basketball again?" And he did. He had minimal problems with pulmonary function after that, but he was never the player he was before.
Well, you probably learned at that time, too, his father was a very renowned high school basketball coach in New Jersey for many, many years, and he had a brother who was also a coach. So a lot of basketball in that family, and I know they're grateful to you for that. Resuscitation has been a particular area of interest to you, obviously as a trauma surgeon and with your experience at San Francisco General Hospital. Do you have anything to share with us related to resuscitation of the injured patient that you would like to emphasize at this time?
Well, I think we were one of the first to recognize the respiratory distress syndrome, and that occurred when I was at the VA. In that era, nobody had been doing aneurysm surgery, and all of a sudden there was a treatment for abdominal aortic aneurysms consisting of replacement. And people started finding aneurysms and found them when they were rupturing. And we became the vascular center for the Northern California VA system. And our rule was to admit these patients directly to the operating room, because almost all of them that were referred were rupturing, and then evaluate them there and proceed with surgery. But post-op, many of these patients developed complications and died. And it was perceived this was a stress of the operation on their heart. And so we subjected them to complete pathologic examination, worked with our pathologist, and we had access to a blood gas machine, one of the first, a $100,000 machine that was purchased by one of our internists to study emphysema. And so I asked if we could borrow that. And a couple of our post-op aneurysms, we checked blood gases, and they were venous level. And so it became apparent that the lung was responsible for the cardiac arrest. And so we looked through the lungs and found platelet microemboli through them and described that syndrome and started to work in a major way of developing an experimental animal that reproduced the ruptured aneurysms.
Another component of this would be your lifelong interest in heparin, in the clotting mechanism. Would you give us a few comments on that, please?
Well, that was thanks to my early days in cardiac surgery. When I was working with Denton Cooley, he was doing 5 open hearts a day, and inevitably we had to take one or more patients back for bleeding. And Denton wouldn't bother to come in. He said, "Bill, just open them up and you won't find anything major." And sure enough, we'd open them up and then kind of mop up and buzz and coagulate everything and so forth, and ultimately the bleeding would stop. And so when I came back to San Francisco, we started a cardiac program there, which was the first funded in the VA system. And I went back to my old mentor, Frank Gerbode, and said, "How much heparin are you using for anticoagulation?" Cooley wouldn't use heparin or negligible amounts, and I recognized that Cooley could do an operation while the patients were holding their breath. So he didn't have long bypass procedures, but Gerbode was more of a deliberate surgeon, and he said, I talked to Herb Perkins, my hematologist, but since I've been using more heparin, our bleeding problems seem less. And so I talked to Herb and said, yes, I think the problem is the pump has taken out all the clotting components. And so we started off then using his recommendation for high-dose heparin. And so I lost my fear of heparin, really. I could operate with a patient fully anticoagulated. They didn't hemorrhage in their brain. They didn't hemorrhage very places. And so as a result of that, and when we recognized the pulmonary embolism syndrome, we kind of put 2 and 2 together and said these patients with aneurysms are probably developing clot in their extremities during the course of the operation, and it's flushed out into their lungs. And the longer the operation and the more they're in shock, the more this garbage goes to their lungs. And what we need to do is use more heparin. And so that became my major interest in anticoagulation. All surgeons were afraid of heparin, right. And because of my experience in cardiac surgery, I wasn't.
You know, we've mentioned a number of your contributions up to this point, and you've written so many chapters and books as well as manuscripts in the peer-reviewed literature. Is there something else that you'd be particularly proud of from your experience and contributions?
I mean, in basic science, well, we became interested in bleeding and clotting and DIC. When I went to the general, I was, because of seeing all these platelet emboli and using heparin and so forth, I became interested in clotting. And the discoverer of factor IX was an internist at San Francisco General. And so right away, I went and talked to Paul Eggeler by name. And I said, Paul, I've been interested in clotting in patients, and I'm seeing some of the similar problems of lung failure and the patients coming in with trauma and in shock. And he said, could you study a couple of patients for me? And he says, sure, Bill, I'll lend you one of my PhDs. And he did. And she started studying my patients. Well, Paul, at that time, came to my office and said, Bill, I'm dying of cancer. No one's around here able to take over my lab. Would you be interested? I'll help you write a grant. And Jeannie then can continue to work with, Gene Robinson continue to work with you, and you can take over support some of my technicians. So he helped me write coagulation grant, and so we ended up with a coagulation laboratory. And we started studying fibrinogen turnover as a documentation that patients who were thought to be anticoagulated really weren't. And that study, fibrinogen turnover, also got me deeper and deeper into bleeding and clotting problems. And we documented, I think the first in surgery, document DIC, because many vascular surgeons, including Jack Wiley, were describing these bleeding problems they have as heparin or making all kinds of excuses. And of course, the reverse was true. Sometimes you needed heparin to stop the intravascular coagulation going on, and the only way to cut the Gordian knot, so to speak, was to recognize that this is clotting depletion that results in the Redding syndrome, as it was called.
Individuals watching this interview may wonder where you found time to do anything else. You've been so busy with so many things, but we've already identified your interest in history, and particularly in the American Civil War. How about railroads in Northern California?
Well, when I was a child, my uncle, the surgeon, was a railroad nut. And Watsonville Junction was a major turning point for railroads. And we'd go take my brother and myself out to the railroad yard. And since he knew the railroad engineers, they would give us rides on the switch engine. And so that was the start of my interest. When I moved to Sacramento, there was a railroad immediately almost across the street, which was the first railroad established in California. It ran from Sacramento to Folsom. And so I got interested in that history and learned that an engineer named Judah had been brought out from the east to develop that small railroad. And Judah had greater ambitions of having a transcontinental railroad. And so he managed to develop a route that was feasible over the Sierra Nevadas, which appeared impossible and passable to railroads. And so the first transcontinental railroad started downtown Sacramento, thanks to Judah's impetus and the big four subsequent merchants that got involved in funding this railroad.
Thank you for sharing that. It's always good to have a hobby, and you've had a number of hobbies. You've been recognized by your peers. Andy Dale's book on the Band of Brothers, finished by Jim DeWeese, who you've already mentioned, and George Johnson, includes you, which is most appropriate. In the trauma arena, you were president of the American Association for the Surgery of Trauma, as well as what we've already recognized, the president of the Society for Vascular Surgery. You've had so many other recognitions, being president of the Pacific Coast Surgical, to being president of the International Michael DeBakey Society. Is there any one of those, or ones I haven't mentioned, that have been particularly satisfying to you personally?
Well, I think involvement in the early days of Society of Vascular Surgery, I'd have to put number one, because that's when our specialty was coming together. And while I was at the VA, I was elected recorder of the society, and that got me involved very early in the programs of the society.
Oh, well, thank you. From all of your colleagues and your friends during that period of time, again, you've mentioned Jim DeWeese. Are there any others that come to mind as being individuals with whom you thoroughly enjoyed collaborating?
Well, Stanley Crawford and I became very close. I worked with Stan for 4 months while I was in Houston, and he was a junior faculty member at that time, and he was kind of doing itinerant vascular surgery. The big boys had the operations at Methodist Hospital, but Houston itself would never refer a patient to DeBakey until Hull froze over. But there were vascular surgery problems. And Stan, as a vascular surgeon, a new member of the team, was willing to go anywhere. So when I worked with Stan, we operated about 3 or 4 hospitals throughout the city. So we became very closely related, and over the years, we had many interchanges. So I'd say he was one. And I was always close to Richard Warren because Richard was the original stimulus for my interest in vascular surgery.
One of the things that you've done over the years, and this may have had some roots in the Navy experience you've had, but you've always been very supportive of the military mission. You were a consultant locally, particularly at Letterman Army Medical Center for many years. You've been on our visiting board at the Uniformed Services for many years, and you received an honorary degree from the Uniformed Services University of the Health Sciences. Would you care to comment on your support of the military, if you will, and of our nation?
Well, I had great admiration for the military. During my tenure during the Korean War on my destroyer division, I ran into a lot of outstanding people, and I ended up with an admirer of the military. They worked for relative peanuts. You know, the salaries for military in that era were small. They're making major contributions to America. We never got out of wars. World War II was the end of all wars, and then the Korean War came on, then the Vietnam War, and so forth. And I had great admiration for all these kids that served in the military.
No, thank you very much. Back just for a moment, one thing that comes to mind about your experiences with Dr. Crawford, Stanley Crawford said so many times that the last great meeting of the Society for Vascular Surgery was when you hosted us in Carmel in 1972. And you may remember that with a lot of fond memories too, because it was a great meeting. It was the last time that the two vascular meetings had a relatively small meeting, I guess you might say. Do you have any comments about that? Do you think about that experience very often?
Well, I enjoyed that meeting, and I enjoyed putting it on.
Right.
And we had to use all the facilities at Carmel, even so. No, but that was good fun. I enjoyed that meeting. I had a few papers on the program in that era, and I'd say met all the big names in vascular surgery as a result of putting that meeting. I was relatively junior at that time, so that was a very excited experience for me.
Oh, thank you. I still remember Dr. Gazet Tackett's was there. You may remember he stood up at the podium and said no one over age 70 should be allowed to come to the podium. Times have changed considerably since then. And as you've emphasized, you were involved in the beginning of many of those changes. What do you think today of vascular surgery fellowship training programs? Do you think they're appropriate today? Do you think there's a future for them? Would you have any guidance for us?
Well, I guess being an old-style vascular surgeon, I really worry about where vascular surgery has gone. It's no longer a cutting specialty. And what I really worry about is that the trainees right now don't get enough open vascular experience to be able to deal adequately with the complication when it develops. And I think that's one of the problems we're having in all of surgery. The emphasis on laparoscopic surgery or endoscopic surgery or endovascular surgery has taken away a lot of the technical expertise that were essential in some circumstances. And so I worry about these kids who finish their vascular training. If something really goes wrong and they have to open an abdomen and deal with a ruptured aneurysm, it's flagrantly all over the place, are they going to be able to handle it? And lack of emphasis on general surgery and going directly into vascular surgery also results in multi-specialists dealing with any one patient. So you have a bowel problem, you call in a bowel surgeon to sew up the hole in the bowel, or if you have an ischemic bowel problem, how are you going to handle that? And does the general surgeon really know enough about the significance of ischemic bowel? As far as we're concerned, we dealt with ischemic bowel. We did a resection, but then we went back the next day, and the next day, and the next day, if necessary, to be sure that the bowel that we left behind is still viable. And these are principles that may well be lost in the course of current training. And that's what worries me, I guess, about our future.
You and I had a Stanford mentor, Carlton Mathieson, who used to say that he was sorry that we missed the golden age of surgery. Do you, at your period in life today, feel the same way about the future generations? And I ask that because you do, among your 6 offspring, have 2 physicians, so you obviously haven't discouraged them from going into medicine. Do you think there's a future for the young people in medicine and in vascular surgery?
Oh, certainly. The only problem with vascular surgery is changing. I'm kind of worried about the case where X-ray radiologists are involved, or cardiologists are involved, and all the endoscopic techniques can be done by non-surgeons. And where is that going to lead? It's going to lead to some amalgam that's going on. I think that putting together all of that particular group, which may take it outside of surgery and a whole new field. But be that as it may, advances occur. We look back on our training, I'm sure you do, as the golden age of surgery. And certainly it was the golden age of open surgery, no question.
Oh, absolutely. As we finish this interview, is there anything that you would like to share with us from your vast experience related to our subject in general? Is there anything we overlooked that you would like to have us include?
So I just commented on my concerns about the future of vascular surgery. I don't have a crystal ball, but there's certainly a great future in surgery, but it's the whole field of technical surgery is changing, and I have no idea where it's going to end up, but it's almost right now opening a belly seems to be something that you shouldn't do. And
since this is a historic event and you're back in San Francisco, maybe we can end by just asking you about your wife, Marilyn, and what she's been doing with photographs of San Francisco that I know you've been very proud of her activities and have supported that. Would you just help us close by mentioning that, please?
Well, in the early days of our marriage, she got interested in history as long as I did. But I think when we moved to the San Francisco VA hospital and lived on the grounds way out there in the point, the entrance to the bay, she became interested in the history of that era. And she got involved with a photographer named Whitney, whose family had a long history of taking glass plate negatives. And he wanted someone, the son of the original photographer, wanted someone to evaluate the collection. And she got involved in looking at this collection of early history of San Francisco and said, gee, you can't sell this off. This has got to be sent to a library or something. I said, well, we're going to sell it off. So she went to the bank and took out a big loan and held the collection till the Historical Society could afford to purchase it. Well, they never did come up with the money to purchase the collection because as it became more and more evaluated, the worth of the collection went way sky high. So she had 10,000 glass plate negatives of early San Francisco. And she was offered a chance to sell San Francisco historical material at the Cliff House. And so she had a shop there for a number of years, and even actually we moved to Sacramento. She'd commute back to her shop. And ultimately, she became recognized as one of the historians of San Francisco. She just received 2 different awards, as a matter of fact, from historical associations this past year for her interest and her knowledge in San Francisco. And she's published a number of photographic books on the history of San Francisco.
Well, you can be very proud of your family, and I think that's an important message to share with everybody too. As a very busy surgeon who made so many contributions, there's still success in the family as well. On behalf of the Society for Vascular Surgery, Dr. Blaisdell, we'd like to thank you sincerely, and Bill, this has really been great. Thank you.
My pleasure.